Calm
I worry about
down.
you people sometimes.
You
So we're gonna
should.
do it.
Okay, no, we're not going to do the previous test. We're going to do that next week when we start with
Okay.
that. So then
Okay.
I'm going to hit a note here.
So we're gonna learn more next week.
Oh, a lot more.
Okay.
Now, with my servo, I have several options. Adult or infant, non-invasive or invasive. Now, you notice, let's go to adult here. And you notice when I go to non-invasive, the whole screen changes color. So if you're covering that unit, just by walking by and looking in, you can tell your patient's on non-invasive because the color of the screen is different. We're not going to do pre-use check. Now, the next thing you need to do is go down here and turn it on. Now, the difference between these devices and a regular and a non-invasive machine like the Vision, these were not initially designed for non-invasive ventilation. They were designed to ventilate people who are intubated or have a tracheostomy, but they have been changed. Now they put in new programs so they can be used from non-invasive. You do have a double circuit here. Whereas with your Vision, you only have a single circuit. So is this a closed or open system?
Close.
Open.
Oh.
No, for
The Vision is open
Yeah.
because your exhalation is external.
I think about that.
This one is a closed system because you're going to measure flow, volume, and pressure on the inspiratory limb, and you're going to measure flow, volume, and pressure on the expiratory limb. So this is your closed system. The big difference here is you have to be careful what kind of mask you use. You can't use a mask that has the exhalation port in it because then you have a major leak. You have to have a mask that is specifically designed to be used with a critical care ventilator that does not have that exhalation port.
Do you need to put filters on the
Yeah, I
other
had
side?
one on here, but I took it off and put it on that one.
Do you still need to use a servo filter with this or no?
What's a servo filter?
Like the filter that you use when the patient's intubated, like the actual other filter. Like I know you need a bacteria filter and then you need the other one.
Well, this is a bacterial filter.
Yeah, I know, but then there's another one that goes on the inhalation port for the servo, I think.
Different from this?
Yeah, like there's
That's the
That's how we
exhalation
had
port,
it set
right?
up.
Yeah, that's
at,
exhalation.
we use two. That's interesting.
At community, we set it up, and that's how they set it up like that.
I'm trying to figure out what kind of filter you're talking
I'll
about.
bring one in,
Okay.
but we
'Cause
use
this
two.
is what we use at Monmouth, and all we use are these things.
We have another one. Like, you know how the 840 has a filter that goes into it? The servo also has a filter that goes on the other
This
end.
must be the new servos.
Yeah.
Okay, because the ones I have don't have it. The ones we have at Monmouth don't have it. Okay. So, anyway, now that I have this attached, I have to make sure that it's the kind that doesn't have the exhalation port. I have to hit my standby button, and now I'm in the ventilator. Where'd the lung go? Okay, I can use this one. Keeping in mind that your patient does have to be breathing spontaneously, no matter which machine you're using. The good thing about these devices is, let me just get rid of this because you're not going to get that. I can set my parameters. This is my peak, and it says pressure support above peak. That's your actual IPAP. Your IPAP on this machine is pressure support above peak. I can go into menu. I can set my alarms. I can go into alarm profile to set my alarms. You want to set alarms always when you have a patient on any kind of ventilator. You're going to set your high pressure alarm. Now this one doesn't give you precisely a low pressure alarm. It gives you your high pressure alarm, high and low minute ventilation, high and low respiratory rate, and your end expiratory pressure, which is like your PEEP or your EPAP. You need to set all of those alarms. My favorite button is that one.
Oh,
Anytime you make a change, you must hit accept. Otherwise, it'll go back to the original settings.
How do you want us setting the alarms for the
Based on what the patient is actually
a 10
getting.
above and 10 below? Or
Yeah,
how do you,
10 above and 10 below.
Mary, what was it? It was high pressure.
Did somebody just call me?
Yeah, can you go back into the alarms for a second?
Back to the alarms.
High pressure, high
Your
low
alarm
respiratory
profile.
rate.
You have a high pressure. You have a high and low minute ventilation. Now your minute ventilation is based totally on how your patient is breathing. Remember, this is all spontaneous. You're not actually giving them a rate.
Right. But we have to give them a rate on there, don't we?
You're giving them a backup rate just like you do on this
Of like a
machine.
6.
You're not giving them a rate here because they're not intubated.
No, just-
they have to be spontaneously breathing. You're going to give a high and low respiratory rate, and mostly this is if your patient becomes apneic or if your patient becomes extremely tachypnic. Can your patient be on non-invasive and become extremely tachypnic? Yes, they can.
That's when we switch them
We
usually.
had a guy a couple weeks ago
Yeah.
community like that and intubating him. He got above
Yeah,
40.
you end up having to intubate them. That's why you need to know that. That's why it's important to set that alarm. And how fast would you want your patient to be breathing if they're on non-invasive? What's normal respiratory
12 to
rate?
20.
So how would you want to set your alarm?
Maybe
25.
25, 30, yeah. 25 to 30, no higher than that. If your patient starts breathing higher than 30 breaths per minute, then he really probably needs to be intubated.
That's what happened to the guy. He was breathing 35.
And the woman at Central State.
Uh-huh.
Yeah. Happened to 2 patients that we recently had.
So this has an internal blender also.
Oh, yeah.
Okay.
Oh, yeah.
But we have to bring in the air to this one. It doesn't take it from the BiPAP. We just
Oh, yeah. The BiPAP, we just hook up oxygen.
right,
This one has 50 psi air and oxygen.
right. Okay.
Besides, it has its own compressor. If you don't have oxygen, an air outlet in the room, it has its own compressor. You can use that.
Oh, okay.
Now, go away. When you're going to change your setting, I'm sorry, you didn't see what I did there. When you're going to change your setting, let's go back to main screen. What you need to do is go up here and hit that, and you get a drop down. Now you can change all of your parameters. You're going to touch the button and turn this button. So if I want to change my peak and my high pressure on my IPAP, which is called pressure support above PEEP, I can change that. Now it's telling me I'm getting a little high here because you notice it turned yellow? And if I get too high, it won't let me go but so far. Okay. Let's go back to about. I can change my PEEP, which is my EPAP. And I can change my FiO2 because like you said, we have a built-in air and oxygen. I can change my inspiratory time. That only applies to if it's given a machine breath. How long inhalation is going to last, or how long it's going to push air in there. And inspiratory rise time is how fast you want it to get to that peak pressure. You can also change this thing called inspiratory cycle off. Inspiratory cycle off controls exhalation. In other words, it's going to cycle off or start giving flow at a preset level that you have set. If it's measuring the flow, inspiratory flow. If you want it to stop giving flow at 50%, then that's what you set. But that's making your IE ratio about 1 to 1. Usually you set it somewhere around 25. In other words, at 25%, at 75% of your inhalation, it's going to stop